If you're wondering if surgery is the answer for your spinal stenosis, I'm going to cover 6 reasons in this short, straight to the point video where surgery might be the answer for you. I'm a physical therapist, I'm an exercise guy, I'm generally an advocate of avoiding surgery at all costs. But in this video, I'm going to list 6 reasons where I'd do surgery myself if I were dealing with these issues. Progressive weakness of the legs. If you find that your legs are continually getting weak over a period of 1 week, 2 weeks, that's a serious sign. And also, if it continues, you'll actually start to see one leg looking smaller than the other. You'll see those muscles start to atrophy. The problem with that is if it goes on for too long, you're not going to get it back. That's a sign that there is ongoing compression of the nerves either in the central canal or the lateral foramen where those nerves exit. That ongoing compression, it's suffocating the nerves that are providing signals and blood flow to your legs. And that's not going to come back until the pressure is relieved off of those nerves through surgery. So that progressive weakness is a major concern. You cannot let that go on for too long. You're risking permanent long-term damage if you don't get that addressed. As that gets worse, you'll start to see foot drop. Sometimes someone is walking and they'll notice their foot starts smacking the ground. They've lost the ability to pick the toes up, to pick the front of the foot up, to clear the feet when they step. So you'll start seeing or hearing the foot smack the ground. That's referred to as foot drop. That is not going to reverse itself. You have to have surgery. Don't let that go on. Worsening numbness or coordination issues in the legs. If you're noticing that you can't feel your legs and that's going on for more than a few days, that's a major indicator that there's consistent compression on the nerves in your canal. And if that compression is not relieved, you're going to get permanent nerve damage. So if those legs are staying numb for more than a few days and not getting better, or if you notice part of your leg is numb and then it's spreading, a bigger portion of the leg is getting numb. So if it starts, at your foot, and then you notice your ankle is numb, then you notice up to your knees, or the other way around, that's a major sign that you need to go talk to your neurosurgeon. Also, changes in coordination. If you're finding that you can't control your legs as well as you used to, if you're stumbling more, if you're tripping more, if you're losing your balance more, if that's going on for a period of weeks and it's not improving, that's another sign that those nerves are being compressed. And as long as they're compressed, you're risking permanent damage. It's not going to get better on its own. Frequent falls. If the weakness or numbness or impaired coordination in your legs has progressed to the point that you're repeatedly falling down, the legs are giving out on you unexpectedly, that's a major problem. Again, that means that there is prolonged continuous compression on the nerves in your central canal. And until those nerves are cleared to breathe, it's only going to get worse. It's not going to improve on its own. And the longer it continues, the more nerve damage you have. And so that's a case where you want to talk to your neurosurgeon and get that addressed. And the more frequently you fall, you're flirting with disaster. I've seen some people that have fallen. Some people get lucky. They can fall 5 or 6 times and not break anything. And then I've seen a lot of people that fall one time and break their hip. So you hope you're one of the lucky ones, but if you start falling, that's a road you don't want to go down. If you're struggling with spinal stenosis, if you're trying to avoid surgery, if you want to maximize your quality of life, check out my free mini course in the show notes below. It teaches you 4 foundational techniques to help take control of your spine today. Spinal stenosis doesn't just go away. You have to take an active role to maximize your quality of life. So check it out. I do believe it'll help you. If your walking distance is extremely limited and it's not improving, that could be another indication that you need to speak with your neurosurgeon, especially if you've learned to recognize when you're getting the symptoms down your legs and you know to sit down, lean forward, give those nerves relief so that you can get back up and walk. You've tried conservative care and your walking distance is still so severely limited that you feel like you can't do things. You can't walk to the end of your driveway to check the mail. You can't go shopping with your family. You can't go to your kid's graduation. If it really is to the point where you feel like you can't go anywhere, especially if you start feeling like you're homebound, that may be an indicator for surgery because at that point it becomes a quality of life issue. And again, this limited walking distance, I'm listing it is an issue after you've taken all conservative measures to try to improve it. When conservative care has failed and you're having unrelenting pain for a period of 6 to 12 months, um, if you feel like you're just miserable and you've really taken steps to try to address it, that may be a time to consider surgery for your spinal stenosis. If you've tried physical therapy, you've tried chiropractic, you've tried modifying your activity, you've learned how to sit down and rest and lean forward to allow your nerves to breathe. You've made changes to your posture. You've tried medications. You've tried injections. You've altered your sleeping positions. You've worked on your nutrition. If you made all these changes and it's been 6 to 12 months and you're just miserable with unrelenting pain, I don't know how you can ask anyone to keep going like that. I would consider surgery at that point. If you're having bowel or bladder changes, that's usually a pretty strong indication that you might need to have surgery. And usually surgeons are going to pick up on that one pretty quickly. If you've lost control of your bowels or your bladder, or if you're having urinary retention, you're not able to go. Any sort of changes like that are usually a red flag. Also, numbness in the groin region, it's called saddle numbness. That often goes along with the changes in bowel or bladder. Any of those signs are a sign of cauda equina syndrome. It's a very serious condition when there's severe compression of the nerves going down your central canal. That's not likely to reverse on its own. And if you start seeing those changes, you don't want to let that go long because you probably won't get it back. So, again, the surgeon will usually pick up on that one pretty quickly. If you're serious about reducing your low back pain and restoring your mobility, check out my free mini course in the notes below. It teaches you 4 foundational techniques you can start using right away.